Okay. Hi, everyone. My name is Robert Zohfeld, and I did my presentation on glucosamine, chondroitin, and MSM. They're all generally kind of taken together, so I just did my presentation on the combination. And I'm going to go over the uses, the side effects, and the metabolism. So here we go. As an introduction, glucosamine and chondroitin are natural substances found in and around the cells of cartilage. So our body does naturally make these substances, these compounds. Glucosamine is an amino sugar that is produced and distributed in cartilage and other connective tissue. Chondroitin is a complex carb that helps cartilage retain water. And MSM is a sulfur-containing compound that enhances circulation and reduces muscle spasms. You can see below the chemical structures. I did do the chondroitin sulfate version because I'll kind of get into it later, but usually glucosamine and chondroitin are both marketed as the sulfate because it is more easily absorbed. But you can see they're basically carbon, hydrogen, nitrogen, and then they combine with sulfate. Supplementation, glucosamine, chondroitin, and MSM are among the most popular supplements in North America. 7.4% of the aging population is taking these supplements. And this compares with like the use of Tylenol. And you can see, I just did 5 random ones at the bottom. I just looked it up on Amazon, but there's like 2,000 different versions on Amazon. And there's a lot of different information on it about glucosamine. So that's kind of why I wanted to do my report on it, just to kind of see how it actually works. The benefits of these compounds. Glucosamine helps build and repair cartilage that binds joints together and has anti-inflammatory properties that help reduce osteoarthritis pain. Chondroitin helps cushion joints and prevent bones from rubbing together. It absorbs fluids and keeps cartilage hydrated and healthy. It also helps with osteoarthritis pain. And MSM is a sulfur compound that supports tendons and muscles. And there's been several studies where it helped a lot with knee pain associated with osteoarthritis, which is a reason a lot of people take it. So why do people take these supplements? Why is it so booming right now? Studies have shown that our bodies are less effective at producing these compounds as we age. Like I said, they're naturally occurring, but we don't make them as easily as we get older. So it helps us if we take them as a supplement. You're more likely to get an injury or inflammation because your cartilage isn't as good when you're getting older. So that's a good reason to take it. It's marketed to endurance athletes and people with osteoarthritis. I personally get that magazine, Runner's World, as I'm a runner. I used to be more competitive, but now I just do it kind of recreationally. And there's lots of articles that I've seen about glucosamine, chondroitin, and the benefits and stuff like that. So it really is marketed for the ultra athletes. Supplementing for osteoarthritis is another reason a lot of people take it. It's the most common form of arthritis that affects 18% of females and 10% of males over the age of 60. And this causes chronic disability due to cartilage wearing down and bones rubbing against each other, which is really painful. Studies have shown that supplements such as glucosamine and chondroitin work best when taken together. There's been studies where they just tried glucosamine sulfate or just chondroitin sulfate, and when they were used together, then there were lots better results when dealing with osteoarthritis. So it's good to take the combination supplement. And about 79% of people with this condition show some form of improvement. And below you can kind of see a healthy joint where the cartilage is even compared to a joint with osteoarthritis where there's not as much cartilage and it's uneven, and that allows bone growth, and it's just not good. And here is another picture where you can kind of see it, and it just looks painful. Like there's no cartilage, and it's just bone on bone, and it looks really painful to me being a runner. There's more research needed in this field, but glucosamine and chondroitin may be linked to decreased cancer risk due to decreased inflammation. One study was over a 10-year period, and they found when taken for a long time, there was a lot lower risk of colorectal cancer, which basically there's less inflammation in the body, which helps reduce this risk of cancer. And another study found that there was a big associated lesser risk of breast cancer. And basically, there does need to be more information and more studies about this, because there's a lot of factors that go into cancer, like BMI, smoking, and stuff like that. And the studies did kind of take that stuff into consideration. But with only about 90 people in each study, it's hard to say on a massive scale how it helped, or how the glucosamine chondroitin actually helped. Metabolism and absorption. Most supplements are in the form of glucosamine sulfate and chondroitin sulfate, because these compounds result in a higher tissue concentration. Basically, the sulfate, it just helps the body absorb it. There's limited absorption of glucosamine in the small intestine at about 26% bioavailability. So it does need to be taken for a long time before you're actually going to see any results. They say look for improvement in like 30 to 60 days, which seems like a long time, but it's just not absorbed that easily. So that's why this takes place. Studies have shown that there is not active transport of glucosamine in the intestine, meaning most absorption would be secondary to paracellular absorption, which is basically just which membranes it can go through, and it's just not absorbed easily. So that's why you just have to take it multiple times a day. Usually they say take it, most supplements are like twice a day or 3 times a day. I personally take it twice a day. And it is detectable in the blood after taking it at about 3 to 8 micromoles per liter. And chondroitin sulfate is absorbed as a high mass polysaccharide. And how this works, how glucosamine and chondroitin work, is chondrocytes are a part of cartilage, and they utilize glucosamine to form glycosaminoglycans and proteoglycans, which attract water and increase resilience. So glucosamine kind of is, again, the resilient one, and then chondroitin brings fluids and nutrients into the proteoglycans, which provides shock absorption, and it keeps the joints healthy and hydrated. And there's also been new evidence in a study where chondroitin and glucosamine are both shown to inhibit nuclear factor Kb. And nuclear factor Kb is basically in an inactive state until IKB receives inflammatory stimulus. And what happens is glucosamine and chondroitin prevented this degradation of IKB, so the nuclear factor Kb never became active, so the inflammation was inhibited, basically, because they kind of go to the underlying factor which causes it. The side effects of glucosamine, chondroitin, the combination supplement has few side effects for your average person. Usually these are listed, not always, on the bottles, but nausea, upset stomach, heartburn, diarrhea. I've never had any problems myself with it. A recent study found that, this is kind of a more disturbing study, where it found that about 85% of normal glycemic patients with a family history of diabetes became hyperglycemic after 8 weeks of using glucosamine chondroitin. Like I said, in this, all of these people had a family history of diabetes, and they were hyperglycemic after 8 weeks. So that's kind of scary. There's been a lot of studies where it didn't affect blood glucose levels. So I wouldn't take that, like you couldn't take it if you have a family history of diabetes, but it's just something you might want to look at, like if you're already pre-diabetic, or you might want to consider not taking it, or consult your doctor about it. The majority of participants became normal glycemic again after 2 to 4 weeks, and I think they all became normal glycemic again after 8 weeks of not taking it. It may also interact with blood thinners and if you're pregnant. So those are kind of the conditions where you might not want to take it. But like I said, with that one study, I'm not completely sold that you can't take it for if you have a family history of diabetes, but it's just something you might want to look at your blood glucose a little bit more. In conclusion, glucosamine, chondroitin, and MSM all work best when taken together. The combination supplement is shown to be the best And like it showed earlier, there's been like 50 studies where the combination supplement works best. It's relatively safe for most people. Like I said about the glycemia and the blood thinners in pregnancy are the times you might not want to take it. Look for dosages in the range of glucosamine 1,500 milligrams, chondroitin 1,200, and MSM 1,000 milligrams. I know MSM is completely, from what I've read, non-toxic. You're not going to get a mega dose of that, so you don't have to worry about that. And I looked at, there were a lot of studies where people took more than 1,500 milligrams a day of glucosamine, and it didn't prove any better results. So it's kind of like a max you can take is the 1,500, and you're not going to get any better results. It's not going to work faster if you take more than that. And these compounds are all absorbed relatively slowly, so they must be taken for a long time to have the desired effect. Like I said, 30 to 60 days. And I believe that's it. There's my sources. And thank you very much, guys.